Hi everyone, I'm Dr. Karthikeyan. In this video, I'm going to demonstrate about dysphagia. Dysphagia is nothing but a swallowing difficulty. In this video, I'm going to explain a mechanism of swallowing and causes of dysphagia, and I have also demonstrated some exercises which will overcome this problem. Okay, first we will discuss about the mechanism of the swallowing. So when you eat, the food particles gets entered into the mouth to the throat. So during this time, there is a closing of epiglottis to prevent the entry of the food particles into the respiratory pathway. Simultaneously, there is an opening of muscles which present behind the epiglottis. That's called cricopharyngeal muscle. This muscle actually open when the food passes from the mouth to the throat and allows the food to get entered into the esophagus. Once the food enters into the esophagus, the cricopharyngeus gets closed to avoid the regurgitation of the food particles from the esophagus to the upper part of the mouth. Okay, this happens continuously. Okay. So after the food enters into the esophagus, it moves to the stomach through peristalsis movement. We used to call it as wave-like movement. So this is a simple mechanism of swallowing. Okay. And now we will discuss about the causes of dysphagia. There are three main causes. The first one is neurological abnormalities. In case of any Parkinson's or multiple sclerosis, the patient may get this dysphagia. Another common neurological abnormality is stroke. In stroke patient, there is damage of 9th and 10th cranial nerve, used to call it as glossopharyngeal and vagus. In case of damage of these two cranial nerves, the patient may get a dysphagia. They may not be able to swallow the food particles properly due to the weakness of these throat muscles. Okay, some kind of muscular disorders like muscular dystrophy and myasthenia gravis. These two major muscular abnormality may leads to dysphagia. Sometimes there is a physical obstruction, that means structural abnormality in the throat. In case of enlargement of tonsils, you may not be able to swallow properly, or in case of any tumors presence in the throat, you may not be able to swallow. So these are all the some common causes for dysphagia. Okay, now I have demonstrated a few exercises which will strengthen your throat muscles, which will stretch your throat muscles, and you can be able to overcome this problem. You can raise. Now we will get entered to the demonstration, please. This is a tongue movement. The simple tongue movements, we are moving the tongue inside the mouth in various directions. See, your right side and left side, upward and downward. This is a diagonal movement. You are moving cross. You are moving your tongue upward, downward, right side, left side and diagonally. You are just pressing. Now you are rotating your tongue clockwise and anti-clockwise. You are just rotating the tongue. Yes. We can also see the movements of the throat muscles while moving the tongue. Okay. Now you are keeping the air inside the mouth. Now I am keeping the air below the level of the lip, and this is the filling of air above the lip. See, downward, you are filling the air downward and upward, keeping it for a few seconds, holding it. Now you can also keep the air right side and left side. Now you are rotating the air clockwise and anti-clockwise. You are just mobilizing the surrounding parts. Yes. Now you are protruding the tongue. You are bringing it out. Upward movement. See? You have to try your maximum. You can observe the throat muscles work. Bringing it down. Bring the tongue downward as much as possible. And you can also bring the tongue towards your right and left. I recommend 5 repetitions each exercises. See the movement of the throat muscles. Even while move your tongue, you can able to move the throat muscles. By saying E, you can activate the pharyngeal muscles. Just observe the movement of the throat muscles. Now I am doing right and left. See this is unilateral movement. Right side and left side. Just observe the movement of the neck muscles and throat muscles. You are just activating the surrounding structures and mobilizing the affected region. See, this is bilateral movement. You are doing both. Just observe the movement of the throat muscles. Good. So this is another way of doing a throat muscle work. See, right and left, you are making the throat muscles to work. Okay. Next, tuck your chin and try to swallow in this position. Just observe, tuck your chin and make swallow action. Tuck your chin and swallow. You can observe the movement of the throat. See, upward downward movement. Tuck in and swallow. Tuck in and swallow. Now you are activating throat muscles. Now you are swallowing air. See, you are just swallowing the air. See how I am doing. Observe the movement of the throat. You are just swallowing the air. Now you are doing resisted exercise for tongue. You are pushing the spoon forward. Just observe. You are just pushing the spoon forward with your tongue. Now you can push right and left. Other side. Yes. Below the tongue, you have an important muscle called cricopharyngeal muscles, which I have explained in the introduction. You are just trying to activate that muscle by doing tongue movements. You are doing tongue resisted exercises. You are doing forward, upward, downward, right side and left side lateral movements. Now you are biting the spoon. You can observe the movement of the throat muscles. See how it works. This is another side. I am just biting. Instead of this spoon, you can also use the toothbrush. You can use the back side of the toothbrush and bite. Okay. Now I am doing bilateral movement, both sides. By doing like this, you can activate the throat muscles. You can observe the movement of throat. This is the resisted exercises to improve the power of the throat muscles. See, I am keeping the thumb and giving resistance by the thumb, moving the chin downward. This is an isometric exercise. I am changing the placement, the same movement. I am moving my chin downward. Simultaneously, I am giving resistance with my thumb. See how excellent it works. Good. Okay. This is also a resisted exercise. I am trying to turn and giving resistance with one hand. Just observe the placement. This is also an isometric exercise. Observe the movement of the throat. The opposite throat gets worked. See? Along with your throat muscles also gets activated. Just observe. Do it gently. Do not get strained. See? I am turning. This muscle is called sternocleidomastoid. I am just mobilizing this. By mobilizing this, you can also activate or mobilize the throat muscles. Just observe. Along with, you can also mobilize the throat muscles. Just give a slight pressure. There are so many arteries passing through this pathway, so you have to be very careful. You have to be gentle. Okay. You just turn and swallow. This is another important exercise which will improve the swallowing. Turn and swallow. See? Turn and swallow. Observe. Turn and swallow. Do these 5 repetitions. See, this is a stretching. See how you are stretching and releasing the tension of throat muscles. Hold this position for 20 to 30 seconds. Go for 5 repetitions. I am doing it again. You can observe. I am showing that. You are just releasing by doing stretching. I am biting the teeth and making the throat muscles to work. Unilateral movement. Unilateral biting. So without spoon or brush, I am doing this. Observe the movements. Yes. Go for 5 repetitions. This is a massage technique. We are calling it as thumb kneading. By placing both thumb, you just make a circular massage like this. That means around the throat. Like this. This is finger kneading. You can use 2 fingers or 3 fingers to mobilize the affected region. You are just increasing the blood circulation to the affected region and giving soothing effect, releasing the tension and re-educating the muscle group as well. Now I am using 3 fingers and doing circular massage around the affected region. Go for gentle pressure. Do not give more pressure. Now I am saying ha, hache, ha. See the movement of the throat. Ha, 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 ha. Okay. Have you seen the exercises? It's interesting, right? I recommend these exercises could be done before eating. That means before 10 to 15 minutes of having your meal, you can practice this to avoid from aspiration, food aspiration, or swallowing difficulty. You can practice this thrice a day initially. Anyone can do these exercises. This is harmless exercises. Even normal people can do this exercise. The purpose of this exercise is to stretching the affected region. To by doing stretching, you can release the tension of the affected region. You are strengthening you are strengthening the muscle group by giving resisted exercises. By the way, you are re-educating the muscle group, and you are mobilizing the affected region by moving surrounding parts. It's very simple. Okay, so anyone can practice these exercises. In the causes, I have left to talk about two important causes. The first one is GERD, gastroesophageal reflux disease. The another one is hiatus hernia. The person who affected by these two problems can also get this dysphagia problem. They can also practice these exercises. I hope these exercises are beneficial to you. Practice this and get benefited. Bye.